Using the terms provided, trace a drop of blood from the spleen back to the heart. To the hepatic portal veins to the liver prior to returning to the heart. That's the point they're trying to make. Liver, hepatic portal, inferior vena cava. So that main vein, I was trying to look at the other diagram we have. I don't have quick access to it, but looking at the handouts that I gave you off that basically came out of the book. So that's a hepatic portal vein all the way from the point that the splenic vein goes into it from the superior mesenteric. So, and through the liver, the hepatic veins run out of the hepatic portal system in the liver into the inferior vena cava. Okay. As far as the veins of lower extremities other than the femoral vein, there are probably two main veins that you need to remember, and those are the saphenous. So let me enlarge this. So would this be here?
Would that be the saphenous, greater saphenous? Or could you scroll down?
Yeah.
Yeah, greater saphenous.
Right here?
Yeah. Probably not.
Any other guesses?
Probably the external iliac.
Think so. Because it looks like it's above that inguinal ligament there, so that would make this what then? Or how about this?
That would be that the great saphenous.
Mm-hmm.
The one above it would be the femoral.
Yep. Make this small again. And what do you got here? A little hint for you.
Anterior. Is that a? Is it trying to say that it's posterior?
Yeah, this is a posterior view.
Oh, popliteal.
Mm-hmm. Yeah. And other than this one, I wouldn't worry about the others.
Small saphenous would be on the one above left side.
Yeah. And then you got this arch and anterior tibial. There you go. Yeah, I can't, they're not going to probably mark any of these veins down low like that. And I think you all were around when we talked about if there's any arteries marked in the distal leg or distal arm, they're gonna be radial, ulna, radial or ulnar arteries, or distal arm, distal leg. If it's behind the lateral malleolus, it's going to be posterior tibial. If it's on the dorsal arch, it'll be the dorsal artery. Okay. We got the larynx here. So what would this be? Make that a little smaller again. That's the cricotracheal ligament. No, wait a minute. Take that back. Thyrohyoid ligament. So this is the hyoid one, the thyroid cartilage. So what's this?
That is the thyroid cartilage.
I believe so. How about this? You're probably not going to mark that. Oh,
Corniculate.
yeah, I think that's the corniculate. And down here, I think those are the, let's see, arytenoids. That may be opposite. We'll find out. And then the cricoid cartilage, the other main cartilage, so you've got thyroid, cricoid, and then the cricotracheal ligament. And then, of course, tracheal cartilage are these down here. I think the cricoid cartilage is the only one that goes all the way around the trachea. There we go. Oh, here we go. So a lot of people struggle with the tidal volume. Those volumes, at least one of those volumes will be on the test. So the four main volumes to remember are tidal, the inspiratory reserve, expiratory reserve, and then the reserve or residual volume. So the amount of air remaining in the lungs after forced expiration is?
Is that the residual volume?
That's residual volume. Mm-hmm. The volume of air exchanged during normal breathing is called, that's the one that was on the quiz.
Tidal.
You broke up a little bit. What was that?
Tidal.
Mm-hmm. Then after normal inspiration, the amount of air that can be inspired forcefully is called? So you're inspiring and then you're inspiring again forcefully. That's inspiratory reserve volume. And you subtract residual volume from total lung capacity. We get vital capacity. Another way to talk about that is that's a maneuver where you blow everything out, or yeah, you take a you blow everything out, then take a deeper breath as you can, and then blow everything out, and that is vital capacity. In other words, inspiratory reserve volume, expiratory reserve volume, and tidal volume all added up. And then vital capacity minus blank equals inspiratory capacity. That's a little tricky. They're messing with capacities here. So I believe that is, let's see, vital capacity minus inspiratory capacity, I believe is expiratory reserve volume. No, it's let's see, vital capacity. That's what equals. Oh, inspiratory reserve volume. Is that right? It says inspiratory reserve volume. And then effects of obstructive disease such as asthma, emphysema, may be determined by measuring, that's forced vital capacity. Where is it? No. Okay. I may have got that second one wrong. We'll see. You won't have anything like that on the test. Yep. Not sure what the right answer is on that, but we'll just move along. Okay, we've kind of gone through this. Okay, which T cell plays an integral role in both humoral and cell-mediated immunity? That's a good question. Humoral and cell-mediated. I believe that's the helper T cell. Yeah. Okay. Place the following airways in order of airflow as air enters the lungs. Okay. What's first?
Primary.
Primary. Very good. Then what?
Secondary.
Good. You left all the hard ones for you guys.
Tertiary. Terminal. Respiratory, and then alveolar.
Yep. That's the way I'd call it. Where we at? Number 5? Yeah. Perfect. Okay, have we done this? No, there's some other stuff on here. Okay, so what's this up here at the top? And I'm gonna, well, yeah, you can tell, I guess.
Would it be the meatus?
Well, those are underneath there.
Wait, sorry,
so,
nasal concave.
Yeah, there you go. And then what's next? You already had it.
The hard palate. Oh, all right, never mind.
No, that's the meatus. So see, they're showing underneath there. You can't actually see the meatus because they're always under the conch.
Gotcha.
And then you already called this out. Hard palate. What do we have there? What protects your trachea?
Would it be the epiglottis?
Yep. Oh, there we go. And what are we talking about here? Pair closes larynx during swallowing. They're talking about the vocal cords, basically. I believe. Is that right? Nope. That's this vestibular fold. And then vocal cords and the trachea, of course. Good. Okay. We're not going to spend a lot of time on this, but let's just go through it real quick and label these. This would be called the white pulp. I think if you're going to be asked any structures on histology of lymphatic organs, it will just be what the organ is. All right. So there's a capsule. And let's see, cornal white pulp artery, I believe it's here. Red pulp. Is there. This should be here. I'm going to miss some of these, I know. Trabeculae, lymphoid nodule, germinal center, and this is spleen. Okay, let's see. Okay, they're calling this lymphoid nodule and this white pulp, I guess. The difference between those two is wider here, so they call. All right. But I would just, now you see those, see some picture looks like that, you know it's a spleen. Know the difference between arteries and veins. Do we need to go over that? know that veins contain valves. This is actually kind of interesting. Veins converge, right? Arteries diverge. They keep splitting. Veins keep coming together. Veins have relatively thin walls, thicker layers of smooth muscle in the arteries, relatively larger diameter in veins, relatively larger lumen, that's veins, superficial location is veins, profuse elastic fibers in arteries, sites used for blood donation. Let's see. No, that should be arteries, of course. That's right. That's right. Okay. I think we're good. Yep. Okay, here's our old friend. So let's hit the major ones here. What is this one down here?
The basilar.
Mm-hmm. Let's see. Let's go up here. What's this?
Anterior cerebral. It is. I've done this one.
Yeah, you're right. You're right. I was anterior communicating, but you're right. Where is it? Yep. Okay. How about here?
Posterior communicating.
Yep. Where is it? There we go. And let's see. Let's get. Yeah. How about this one?
Anterior communicating.
Mm-hmm. And right here.
Those are the internal carotid.
Yes. What would that be?
Middle cerebral.
Mm-hmm. And then the posterior cerebral. We've kind of beat those to death, don't we? I think we know those pretty well. Okay, following major systemic veins.
Didn't we already do this one?
Did we? Well, I think we
It was
know
like
it pretty well.
the
Yeah, we
first
did.
one.
We did. You're right. We did. And I don't want to spend too much time on this. This is a lymph node. Everybody agree? Well, it is. So, and if somebody asks a layer on this or something like this, they might say, okay, this down here is the medulla. This is the capsule. But as you all know, we don't have anything this clear. If we had these nice specimens like this, we could ask more detailed questions, but I don't think we can. So. Head and neck, we need to go over this. Everybody okay with this? Vertebral arteries, internal carotid, common carotid. Any questions or you want to go through it in detail? Okay, we will. Let's see, what's this here?
Internal carotid.
Uh-huh. About here.
External.
Mm-hmm. This is one we haven't really pointed out. But that's a carotid sinus. So that's where the baroreceptors are. And if you notice, it's right as the internal carotid takes off from the common carotid. Everybody see that?
Yes.
Okay. And then right here, what is that? Vertebrals. And then let's see, where's that label on the common carotid? Oh, there it is. And then you've got costo cervical. So what is costo always means rib. So the costo cervical trunk, I believe it's pointing to, let's see. I think it's that one. Thyrocervical, I believe, is there. Yeah. Okay, good. Pulmonary circulation, I think essentially just know you've got your right and left pulmonary arteries, and any more detail than that I think would be unlikely. Yeah, right ventricle, left ventricle. I don't think there's superior vena cava. No new information. Okay, and pretty sure these won't be on there. Okay, what are we looking at here? What would this be? It's a longitudinal view. So
Would it be epithelium?
no. No, this, what organ is the structure from? This is trachea, I'll just let you know. So you've got cartilage in there. This is what they're calling a hyaline cartilage, probably. So that's here. Then they're actually showing mucus. So the little cells within there are chondrocytes. Have goblet cells. What do goblet, whoops, put that in the wrong place. What do goblet cells do? They secrete mucus. So so those are in there. Then you have mucus glands there. I think what, I can't tell which is which. They're probably saying that's, these are debris. So they're trying to make the point here. Oh, here we go. It goes there. That's the epithelial ciliated cell. And then that's mucus. So they're trying to show the mucociliary elevator. That was the other question that a lot of people missed that we talked about, to move debris out of the trachea and keep the trachea clean. Any questions about that? Let's see. Single word in each sentence to make it correct. Blood flow. Oh yeah. So this is regulation of blood flow. So blood flow is blank according to metabolic needs. That'd be redirected, right? Where you're trying to increase blood flow where there's greater metabolic need. After a meal, the blank receive priority and skeletal muscles receive very little flow. What would that be? What do you use after a meal? During exercise, the skeletal muscles receive blank blood flow. That'd be more probably. Most of the redirection will occur in the, most of all redirection will occur in arterioles, right? We've talked about arterioles are those with the vascular supply. Again, it goes back to resistance and flow. You clamp down the arterioles in skeletal muscle after a meal. You clamp down arterioles in the intestinal supply, blood supply, when you're exercising. So after a meal, that'd probably be intestines, wouldn't you think? Okay. Single word each sentence. I think that's more detailed than we'll be going into. All right. So this is just recognizing these different organs. So which of these is lymph node? What'd you think? It's this one down here. You see this big medulla down here, surrounded by these kind of germinal centers there. So that's lymph node. Tonsil. I think that's this one here. Spleen has these white pulp and germinal centers that we saw. So the spleen is located in the abdomen, of course. Tonsils found in the oral cavity. Spleen functions in the production of new lymphocytes. Tonsil functions in protecting against ingestion of react to ingested antigens. Let's see. And found along lymphatic vessels, that's lymph nodes, and function of proliferation of active B lymphocytes. I think that's that. I may have these backwards here at the spleen, but let's see. Yeah. So this should be it's in the lymph node, and then production of active B lymphocytes is in the spleen. because you're processing B lymphocytes to plasma cells there. What are monocytes that migrate to the tissue and function as phagocytic cells called?
Macrophages.
Yep. Arteries of the abdomen. You guys know these pretty well, I think. So you got your celiac trunk down here. What's this one that comes off to the stomach? Three arteries that come off the celiac trunk. One is
Hepatic.
Would the other be splenic?
And left or right gastric. No, left gastric.
left gastric. And so that would make this the right gastric. Gastroduodenal we could never really find well, but let's see. That would be this one here. And then left gastromental. There we go. Okay. Okay. I think this is probably a level of detail that we don't need to. We're going to know the difference between lymphatic organs, lymphatic tissue, lymphatic cells. Organs are those things you know about: thymus, lymph nodes, spleen, tissues, those things found along the GI tract. Tonsils, I think, are considered organs because they're clumped together in a specific group. So I think those are the main concepts to be gathered there. Okay, veins of the pelvic region. This is what we were looking at earlier. Probably good for us to kind of go through this one more time. So again, it's the portal system. So it's separate from the inferior vena cava. Nowhere other than when it runs into the liver does anything flow necessarily into the inferior vena cava. Okay, everybody get that concept? Does everybody understand that?
Yes.
It's a separate system.
Yeah.
Yeah. Okay. And so the left colon, inferior mesenteric. So right, left, and unique is this runs into the what? What is this corkscrew kind of vein? It has a partner that's a corkscrew kind of artery. Kind of runs across the stomach to this big organ over here, which is a what? So that is a spleen. That would make this the splenic vein. No correction. Splenic vein. No wonder you're confused. Yeah, splenic vein. And so this is gastric vein. I apologize. So this runs into the hepatic portal vein. So hepatic veins are up here, where the liver empties into the superior or inferior vena cava. And hepatic portal veins there, hepatic veins empty into the inferior vena cava. And then this is the gastro-omental arteries, and then you have this little cystic artery that supplies the gallbladder. All right. So splenic vein runs behind the stomach into the spleen. Inferior mesenteric vein runs into the splenic vein. Superior mesenteric vein runs into the hepatic portal vein. So splenic vein merges. Okay. I want to make a correction here. So these are the gastric veins. This is gastro-omental because it runs along this edge. And then the gastric veins, right gastro-omental, it comes off here. Gastric veins roll into the hepatic portal vein. Okay. Gastric, splenic, gastro-omental. Probably won't see this, but all right. And we do have the celiac trunk down pretty well, don't we?
Yes.
Yeah.
Yeah, I think so. We have kind of beat this to death, but justifiably so. It's confusing. Okay, multiple choice. The body's largest lymphatic organ would be the spleen, right? Which term refers to the feedback response, blood pressure changes. We already covered that. We already did that one. Okay, arteries of the upper limb. We haven't done this yet. So looks like we're starting. Looks like everything's below the elbow here. So and they're just focusing on the small arteries here. So these you're not going to see, but of course these are interosseous arteries. We've got ulnar and radial artery. And I think those are the only ones you really need to worry about. We've done that. Eosinophils are seen in what?
Allergic reaction.
And parasitic infections. Very good. systemic veins, I think we've done those. Where the I don't think we've been through this. So this is the cross section of the trachea. We did a longitudinal section. What is this muscle called? As opposed
The
to
trachealis.
yeah. I suppose somebody could pin that. On a trachea that's been removed or bent, or a model. So what is this?
Is that the hyaline cartilage?
That's right. And the lining. It's a mucosa. And they're showing a mucus gland there. And then oh, I see what they're doing. So this is the hyaline ring. And then they're showing the outside edges of the cartilage is the perichondrium. We've been through this, right? Yeah. And lymph node, we're not going to go through this. Diastolic pressure is the minimum arterial blood pressure occurring during which of the following? Exhalation, ventricular contraction, ventricular relaxation, inhalation. Diastolic pressure. When does that occur?
Relaxation.
That's right. So what's happening then? You're filling the ventricle with blood, right? So that's when the pressure drops. Which two muscles groups are primarily responsible for resting, non-forced inspiration?
The diaphragm and intercostals.
I've seen this on several tests. Where's the greatest volume of blood found in the body?
Veins.
Yep. Okay. Which of the following is the function of the lymphatic system? I would know this too. So all that apply, it recovers fluid, right? It does remove foreign matter from the fluid. Doesn't secrete hormones. It does absorb dietary lipids. I do not believe it absorbs dietary proteins. So where do dietary lipids, what part of the lymphatic system absorbs and puts dietary lipids into the circulation? Might not know that, but you guys should remember this. Maybe not now, but you should remember it for Wednesday. I'll just tell you. It's our old friend, the thoracic duct. Okay.
What was the question again?
What part of the lymphatic system absorbs lipids or is responsible for the collection of lipids from the intestine? And there's this, what's it called? The highly, what is that? Hang on. It's called a cisterna chyli, CHYLI, and that it turns into the thoracic duct. So it's kind of a little collection or pouch that has lymphatics that run from the small intestine, collects lipids, and then they flow through the thoracic duct into the left subclavian vein. Don't need to know all that, but just know thoracic duct. I don't think you even need to know cisterna chyli. But maybe there'll be a picture here in a minute. But that, just remember, those are associated with dietary lipids, basically because those are the lymphatics that run from the small intestine. They don't necessarily run through a big lymph node yet. Okay. Which protein inhibits the viral infection of neighboring cells? So you guys remember that, right?
Interferon?
Interferon, right? Good. Small organ found along the course of lymphatic vessels, filters lymph and functions activation of B and T lymph cells, called a lymph node. Correctly labeling and following anatomic. Okay, we're not going to do that. Which structure is highlighted? Well, that is hard to see. It's an artery coming off, going to the right side of the abdomen. So what would that have to be?
Would it be the azygos?
No, it's an artery.
Oh,
That'd have to be superior mesenteric, wouldn't you think?
Yeah.
It looks weird there. I have to agree with you. It looks like it's coming off the side of the aorta, but just with its distribution, it's just another example of just every time you're asked to look at an artery, don't just look at that artery, look at where it's going and where it's coming from. But where it's going will very frequently tell you what it does. Unfortunately, some of our arteries don't go anywhere anymore. They just rip loose. Okay, we've done this. Okay, anatomic features of the thymus. I don't know that there'll be anything on this. Again, because of our challenging specimens. Okay, so you know that this big artery that supplies the front of the brain is not the very front of the brain, but the large majority of the brain is called the what?
Anterior cerebral.
Um,
Are you talking about the one that's being pointed at right now?
yeah,
I believe
yeah, that's right. That's right. And let's see. Well, they're showing corpus callosum, pituitary gland, and then, of course, this one coming out the back here, posterior cerebral. And then the middle cerebral runs out and around the outside of the cerebral hemisphere. There's a pituitary gland and the corpus callosum. Okay, one more time, since these are challenging. The amount of air remaining in the lungs after forced expiration.
Residual volume.
Mm-hmm. Good. The amount of air that can be exhaled in a given time interval. Let's read these others. The amount of air that can be exhaled over the tidal volume. And the amount of air inhaled and exhaled during quiet breathing. Which one is that?
Tidal volume.
Yep. So one of these is going to be above, and one is going to be actually a maneuver. So the amount of air that can be exhaled in a given time period, that's a measurement of how severe your bronchospasm is in an asthmatic. So that would be FEV. And so, of course, the amount of air that can be forced out above tidal volume, that's expiratory reserve volume. What was that, 3? Yeah. Oh, wait. I don't know what this thing is doing to me here. Residual volume. Yeah, that's 1. And 1 is, okay. Okay, tidal volume is number 4. FEV is number 2. There. Okay. Sorry about that. And this keeps challenging us with the lymph node. And we've done this one. B cells, T cells, I think. Well, we can, yeah, let's go through this quickly because that might help. Okay, include helper T cells lines. Which are those? It's one of the 4 different types of these cells. So it's T cells have 4 different types. One is helper, produces memory cells. That's also T cells. Antibody mediated immunity, always think B cells. Direct activation, that's something we haven't covered. You probably covered it in lecture, I suppose. Arise originally from the bone marrow. Those are B cells, or actually, I think both. Mature from thymic tissue. Those are T cells. Differentiate into plasma cells when activated. Those are B cells. IgG and IgM formation, that's B cells. Can produce lethal hits to infected self cells. I think those are T cells. And let's see. I believe, I'm not sure which ones these are. We haven't covered that. Let's put one of those there and one there. I don't think that's right. Yeah. Produces memory cells. Okay, that's B cells also then, or both. That might be both. That is both. And this MCH1 is also in T cells. I just remember B cells, plasma cells, IgG, IgM, and T cells, helper cells, and natural killer cells that are pretty lethal killers, especially a virus. Okay, so which structure is highlighted? It's another one of these confusing highlighted pictures. Looks like an artery. And I think, any guesses? I think this is the celiac trunk and this is coming off. So I'm thinking that would make that the splenic artery. Any other suggestions or thoughts? I don't know. Splenic, true mesenteric. Yeah, I think, I don't know. That's what I call it. I'm not superior mesenteric, splenic. Yeah, okay. Okay, we've done this. air bronchogram. You guys did a good job on those a while ago. Just an x-ray. And you don't need to know about segmental. So I think you're good with the primary bronchi and the trachea. Here's tonsils real quickly. We already decided that this was, well, that since they're labeling a space there, that's probably a meatus that they're trying to point to. What is this sinus here?
Would it be ethnoid, I think, or sphenoid? Well,
I think it's sphenoid. Let me make this small. Okay. Here's this little friend, uvula again. And they're showing a palatine tonsil. Oops, I labeled that wrong. There. This thing here. What do you think they're trying to show there? I think they're trying to show a palatine tonsil. It's right in the side of the throat, on one side of the throat. And then, let's see, right here, what would that be? I think that's pharyngeal tonsil. Up high. So see, here's the mouth. I always try to remember these with orientation to the mouth, what you can look in the mouth and see and can't see. So you look through, if you're looking into somebody's mouth, you can see palatine tonsils, and the kid especially. You couldn't see a pharyngeal tonsil. And these are also sometimes called adenoids. And then this is showing a lingual tonsil down here behind the tongue. They don't ask you to label that. And then this space over here is this auditory tube, right? And then soft palate, of course, in the back of the throat. Okay.
I have to head out.
What's that? You got to go?
Yes, sir.
Okay. I think that with what we've made it through, you guys should be doing pretty good. A lot of this, we've been through over half of these. It's pretty redundant. I'm happy to keep going if you guys want to, those of you who want to stay. But if you have to go, I understand.
Thank you.
Okay. Isabel, you and KJ want to keep going?
I think I feel good about the review so far.
Okay.
I think.
Okay.
I'm okay with anything.
Okay. Very good. Well, I will let you guys drop off. I'm going to just give your classmates the same kind of overview that I gave you at the first that we didn't capture on the recording. And then I think they'll all be up to speed if they watch this. Okay.
Well, thank you.
Okay.
Thank you. Really appreciate it.
Good luck to you all Wednesday.
Have a good night.
Okay, you too. Bye-bye. So for those of you who weren't on this call from the beginning, we turned on the recording a little late. And so I did want to give you the same update that I gave the others. And that is looking at the just kind of the layout of the format of the test. It will be similar to the last one. A lot of structures to identify, 30 in total. About 20 of them will be vessels, blood vessels. About 3 will be histologic. And about 5 will just be different structural anatomic structures that are called out. So mostly the circulation will make up by far the majority of the those, at least the way it's laid out right now. And then you'll have another 20 questions, most of which I don't think you should have any trouble with. About a third of them are functional questions, asking about the function of particular cells or types of tissue or systems. So if you're prepared for that, I think you guys are really well prepared on the circulation and the anatomy there, and can identify most of those major vessels on the cadaver. So I think you all will do well. Also wanted to mention about the quiz. The quiz is posted. 2 updates, and I think I left a note for everybody on where that the last question that asked about flow and the relationship between pressure and resistance. So the question was that blood flow is directly related to pressure and indirectly related to blank. Everyone in the class put volume. So my point here, and I asked the group that was on the call, if there, or on the Zoom session, if there was something that you all had learned in another class or something that was making you make that choice. And it seems like the consensus was, it was kind of a guess, trying to think what goes with pressure. And I kind of understand that. The thing I emphasize to them and want to emphasize to you is to think these things through. So if you think about just the math and the relationships of these components, number one, just look at the units. So flow is also a pressure, a volume rate. So it's milliliters per second. And the relationship of flow to volume will be direct, correct? So if volume goes up, flow should be increasing, and vice versa. So having volume in the denominator would be an inverse relationship. You'd be saying, well, volume went up and flow went down, or volume went down and flow went up. Well, that doesn't make sense. So you need to think of another option. The only other thing that was discussed relative to influencing flow was blood viscosity, which reduces flow because it increases resistance. And number 2 is the length of the vessel. But I don't think you all can confuse that or that those were things that you were thinking about in this particular answer. So it's just some advice for future test taking skills, and that is to apply some thought just beyond raw memorization to answering your questions and thinking through problems too in clinical situations. So I think that's all I had to say. We went through a few other items before we started recording, but from what we captured when we turn this on, I think you should have a pretty good coverage of the material that may be on this exam and be ready for it. So I wish you all the best. I regret that I can't be there with you, but feel confident you all are prepared. So I look forward to seeing you week after the following week when we start on the digestive system. So, and we'll be anxiously looking to see how you did on your tests and score your tests. Oh, the other thing I might add is that I need to turn in your midterm scores tomorrow, but you could actually go out and look now that I've posted your quiz. That'll be the last grade to go in before the midterms. And so you can see what your midterm grade is going to be going in tomorrow. So thank you, and we'll see you next week.